Imagine this: a young adult, seemingly healthy, suddenly notices a painless lump on the side of the neck. No pain. No injury. Just a lump. At first, they ignore it, but weeks later, they're struck by night sweats, unexplained fever, and weight loss. What's happening? This isn't just a common cold or infection, it could be Hodgkin's disease, one of the most intriguing and potentially deadly blood cancers. Stay with me, because by the end of this video, you'll understand everything from its origins to the precise nursing care required for patients battling this disease. Hodgkin's disease, also known as Hodgkin lymphoma, is a malignant disorder of the lymphatic system, characterized by the presence of a very specific abnormal cell, the Reed-Sternberg cell. This is what makes it unique compared to other lymphomas. It's a cancer that begins in the white blood cells called lymphocytes, and then spreads in a predictable manner from one group of lymph nodes to the next. This disease was first described in 1832 by Thomas Hodgkin, a British physician, who noticed the abnormal enlargement of lymph nodes and spleen. Since then, medicine has uncovered how this cancer evolves and why it is so distinct from non-Hodgkin lymphoma. Now here's where it gets interesting: scientists still don't know the exact cause. But we do know the triggers. The strongest link is Epstein-Barr virus, EBV, infection, the same virus responsible for mononucleosis. Genetics also plays a role, especially if close relatives are affected. And the risk is higher in males, in young adults aged 15 to 35, and in people with weakened immune systems, such as those with HIV or post-organ transplant patients. Let's break down what actually happens inside the body. A genetic mutation occurs in a B lymphocyte. This abnormal B cell transforms into the classic Reed-Sternberg cell, a giant multinucleated cell seen under the microscope. Instead of dying, this cell survives and begins to proliferate uncontrollably. The lymph nodes enlarge as cancer cells multiply, but they don't just stay there. Hodgkin's spreads orderly from one lymph node region to the next, unlike non-Hodgkin's, which spreads randomly. As the disease advances, it infiltrates organs like the spleen, liver, bone marrow, and even lungs, leading to systemic symptoms. Here's how it shows up in patients. Painless lymphadenopathy, the hallmark sign. Lymph nodes in the neck, armpit, or groin enlarge, but remain painless because they are filled with malignant cells, not inflammation. B symptoms. Fever, due to cytokine release. Drenching night sweats, a systemic inflammatory response. Unexplained weight loss, because the body is burning energy fighting the malignant process. Pruritus, itching, caused by cytokines and histamine release. Alcohol-induced pain in lymph nodes, a rare but very specific sign. Splenomegaly and hepatomegaly, when disease spreads to the spleen and liver. Fatigue and anemia, due to bone marrow involvement. So far, we've uncovered how Hodgkin's disease begins: an innocent lymph node turning into a battlefield of Reed-Sternberg cells. But here's the big question: how do we know for sure that this silent enemy is hiding inside the body? And once discovered, what weapons does medicine have to fight back? Let's dive into diagnosis and management. The journey to diagnosis often begins with something simple: a swollen lymph node. But to uncover Hodgkin's disease, doctors need solid proof. Here's the step-by-step breakdown. Physical examination: palpation of lymph nodes in the neck, axilla, and groin for size, consistency, and tenderness. Lymph node biopsy, the gold standard. Excisional biopsy reveals the Reed-Sternberg cell, confirming Hodgkin's disease. Blood tests look for anemia, elevated ESR, abnormal WBC, and liver function changes. Imaging, chest X-ray, CT scan, MRI, or PET scan show the spread of disease across lymph nodes and organs. Bone marrow biopsy, done in advanced stages to detect marrow involvement. Staging, an Arbor system, this determines treatment. Stage I, single node region. Stage 2, multiple nodes on same side of diaphragm. Stage 3, nodes on both sides of diaphragm plus or minus spleen. Stage 4, widespread organ involvement like liver, bone marrow, or lung. Treatment is tailored based on stage and patient condition. The weapons? Chemotherapy, first-line treatment. The ABVD regimen is most common. A. Adriamycin, doxorubicin. B. Bleomycin. V. Vinblastine. D. Dacarbazine. This cocktail directly targets rapidly dividing cancer cells. Radiation therapy, used for localized disease, especially in early stages, to destroy malignant nodes. Combination therapy, chemo plus radiation equals higher cure rates. Targeted and immunotherapy, monoclonal antibodies, like brentuximab vedotin, and immune checkpoint inhibitors are modern approaches, especially in relapsed cases. Unlike solid tumors, Hodgkin's disease is rarely treated with surgery. Surgery is mainly diagnostic, removing a lymph node for biopsy. Occasionally, splenectomy may be done if the spleen is massively involved, but it is not a primary treatment. Supportive and complication management, blood transfusions for anemia. Antibiotics and growth factors for infection risk during chemotherapy. Fertility preservation, sperm banking, egg preservation, before chemo/radiation, as treatments often cause infertility. Psychological support, because the emotional weight of cancer can be just as heavy as the physical. Caring for a patient with Hodgkin's disease is not just about monitoring chemo drips or charting vitals, it's about anticipating complications, preserving quality of life, and empowering the patient through a very uncertain journey. Here's what nurses focus on. Infection prevention, patients on chemo are immunocompromised. Strict hand hygiene, protective isolation if neutropenic, and avoiding exposure to crowds or sick contacts. Managing chemotherapy side effects, monitor for nausea, vomiting, mucositis, hair loss, infertility, and especially febrile neutropenia, which is a medical emergency. Monitoring organ toxicities, doxorubicin, heart toxicity, bleomycin, lung toxicity. Nurses must assess for cardiac changes and respiratory distress. Nutritional support, small, high-calorie, high-protein meals, encourage oral care for painful mucositis. Psychosocial support, address fear, anxiety, and depression, provide counseling, connect patients to support groups. Fertility counseling, discuss sperm/egg preservation options before starting treatment. Patient and family education, importance of follow-up, recognizing early signs of relapse, lifestyle adjustments, and vaccination updates. Nursing process for Hodgkin's disease assessment, collect history of weight loss, fever, night sweats, pruritus. Examine for painless lymphadenopathy. Monitor lab values, CBC, ESR, liver function. Assess for chemo side effects, fatigue, infections, mucositis. Evaluate psychological state, fear, anxiety, body image issues. Nursing diagnoses, risk for infection related to immunosuppression. Imbalanced nutrition, less than body requirements related to treatment side effects. Fatigue related to disease process and therapy. Anxiety related to cancer diagnosis and uncertainty. Risk for infertility related to chemotherapy and radiation. Planning and goals. Patient will remain infection-free. Patient will maintain adequate nutrition and hydration. Patient will verbalize coping strategies for anxiety. Patient will demonstrate knowledge of disease, treatment, and follow-up care. Implementation. Use neutropenic precautions, mask, hand hygiene, protective isolation. Provide antiemetics, oral care, and dietary modifications for nutrition. Conserve energy, plan rest periods, cluster care. Offer emotional support, counseling, and family involvement. Teach safe practices, medication adherence, and follow-up schedule. Evaluation. Patient maintains stable vital signs and no infection. Weight maintained or gradually improved. Patient reports reduced fatigue and improved coping. Patient demonstrates understanding of treatment plan and precautions. And here's the power of nursing: you don't just treat Hodgkin's disease, you treat the person who carries it. You stand guard against infection, you guide them through fear, and you celebrate remission as much as they do. So remember, Hodgkin's disease may be one of the most curable cancers, but cure is not the end. Nursing care is what carries the patient from diagnosis, through treatment, and into survivorship. If you found this breakdown valuable, subscribe to Nursing Blueprint, because here, every disease becomes a lesson, and every lesson brings you closer to being the nurse you're meant to be.